Good morning, everyone. My name is Yasmin Tarver, and I am the Director of Workforce Development at the Genesee Center and a member of the Leadership Council for Domestic Violence and Healthcare. And we would like to welcome you to our 5th annual Beyond Silos Symposium. So I'm going to start our day with a few announcements. So if you don't want to have video or photo, there's tables in the back that say no video or photos. We would like to thank our sponsors, the Blue Shield Foundation and the National Health Resource Center on Domestic Violence, a project of Futures Without Violence. Today, for those who have never been here and for those who are returning, the self-care room has returned. It is in the Mojave room. It is a time to go relax, relate, release in the short time that you have. We ask that you take one of everything so that everyone can enjoy throughout the day. And if there's something that you really like, please let one of the attendants know and we can get you the information on how to obtain that. We also would like for you to visit the exhibitors. Some of you saw them when you came in, and the CEU table that is directly out in the front in case you need that. We will have raffles throughout the day, so please hold on to those raffle tickets. There are pins and QR codes for your evaluations that need to be filled out at the end of the day, and once you fill that out and show proof to the table outside, we have a wonderful gift for you to take home. There are index cards and pins on the tables if you have any questions or you just need to write some notes. There is also on your table the QR code to get the program. We're trying to be a little bit more environmentally conscious as time goes on. Today, we also have the return of a networking reception for the last part with our DERVs at the close of the conference. And we also have the return of DJ Refresh. He will be playing through our breaks and our lunch to give us a little spirit. So with that being said, I have the pleasure of introducing Richard Thomason, and I'm going to read some of his bio. I'm sorry. I haven't had any coffee yet. I'm supposed to be showing a video from our Surgeon General, Dr. Diana Ramos.
Welcome to the 5th annual Beyond Silos Symposium. In 2017, a consortium of 4 committed DV advocacy programs joined forces to develop the Domestic Violence and Healthcare Leadership Council. These organizations include the Genesee Center, East Los Angeles Women's Center, the YWCA of San Gabriel Valley, and Community Legal Aid SoCal. Together, they have transformed the way systems change work looks right here in Los Angeles County.
Because domestic violence is not a standalone issue, ending domestic violence requires a trauma-informed, culturally and linguistically relevant, coordinated community response. That is why we are here today.
At the Foundation, we focus on healing and prevention by directly addressing root causes.
And then that just brings on a reassurance to a survivor that I'm supported, I'm cared for, they want to see me prosper and thrive.
But this work is emotional and this work is really personal. And then a lot of us do this work for that reason.
Why are we here? Why are we in this work? Why do we stay in this work, right? There's both professional and personal reasons for that.
From self-organizing around a shared vision to forging new pathways to strengthen promising practices around DV and healthcare partnerships, the Leadership Council is advancing transformative collaboration and strategies toward a truly survivor-centered care network. By engaging critical partners, including the Los Angeles County Department of Public Health, learning from both survivors and service providers, and building capacity across the health and DV workforce, the Leadership Council is disrupting paradigms around how we address the unique needs of survivors and their families. We aim to work beyond silos to break the cycle of domestic violence, improve healthcare response, and ultimately change systems here in Los Angeles to ensure all survivors have the support and services they need.
Okay, so how it really was supposed to go is we were supposed to have the introductory video, which you just saw, and now I have the pleasure of introducing Richard. Richard Thomason serves as the Director of Policy at the Blue Shield of California Foundation, where he leads the development of initiatives that leverage public policy to achieve the foundation's mission. Mr. Thomason joined the foundation in 2009 as a program officer and has led the foundation's efforts to make California the healthiest state, expand health coverage, and improve access to care for vulnerable populations, and strengthen safety and net and healthcare systems. Prior to joining the foundation, Mr. Thomason was the policy director for SEIU United Healthcare, deeply involved in the full range of healthcare reform and healthcare systems issues facing SEIU and its membership. Previously, Mr. Thomason spent 8 years as the professional staff to California Assembly and roles related to health and fiscal policy. In addition to his work in the California legislature, Mr. Thomason has worked as a community relations representative for Kaiser Permanente and as a legislative staff member to U.S. Senator Bill Bradley. He has been a member of numerous boards and commissions, including the Alameda Alliance for Health Board of Governors, the California Healthcare Coalition, the Berkeley Community Health Commission, and the Alameda County Public Health Advisory Commission. He has a master's degree in public affairs with a concentration in domestic policy from Princeton University and a Bachelor of Arts from Reed College. And let's welcome Richard.
Thank you. Well, I guess I've been at this a long time with all that. But I'm really happy to be here again with you all and the Leadership Council to support this work to break silos, to break the cycle of domestic violence. Really want to express my appreciation to the Leadership Council, the organizations involved in it, the LA County Department of Public Health, and all of the organizations and survivors here in the room today, because this work is really important. I'm really excited about today's sessions. Are y'all excited? This is going to be really interesting. Good. Okay. All right. I know, it's still early. It's still early. Time to wake up. So, for 20 years, Blue Shield of California Foundation has partnered with organizations, leaders, and advocates around California with the goal of ending domestic violence and creating safety for survivors. We've learned domestic violence is everywhere, but it's healable and it's preventable. It affects 1 in 2 Californians, affects children's, extended families, and entire communities, as you all know all too well. That's why the partnerships that we're going to talk about today are so important. Because domestic violence is such a widespread concern, it takes many organizations, many sectors, and all of us to partner together to build the kind of safety net that survivors deserve. So I want to touch on 3 areas that the foundation is working on, where we're partnering actively with domestic violence organizations. So first, we've been partnering with domestic violence policy advocates and federal policymakers to increase federal funding for domestic violence intervention and prevention services, including for restorative approaches that can offer survivors another way to address harm outside the criminal legal system. We support organizations advocating for more funding for housing for survivors, more funding for culturally specific services, and more funding to support immigrant survivors. We were really honored this month to be invited to the White House for the celebration of the 30th anniversary of the Violence Against Women Act. And it was really moving to hear President Biden talk about his personal commitment to the issue and how that was his proudest legislative achievement. We were thrilled to bring several California leaders with us, including Karen. Didn't we have a good time? Wasn't that fun? So it was just nice to be there and have a celebration on the South Lawn of the White House with 1,000 of our nearest and dearest friends from around the country. And so it was just great to see the movement there and all the survivors, all the advocates who had been working on this issue, sometimes a few years, sometimes many decades. So that was a lot of fun. Second, we're proud to support the California Partnership to End Domestic Violence, Futures Without Violence, Valor, and many of you in this room in your advocacy for state funding to backfill for declining federal Victims of Crime Act funds. Reductions in federal funding threaten to cut many domestic violence intervention and prevention services. And so we're really proud of everybody who came together this year to win $103 million in state funds to backfill, to prevent those cuts. So I'd like to give y'all a round of applause for that. Everybody who talked to their state legislators, who sent emails, who went to Sacramento, that was a huge achievement and a really big darn deal. That's a lot of money in a tough state budget time. So I'm just so proud of the whole domestic violence victim services movement for winning that funding. However, as you'll hear this afternoon, the fight's not over. And rest assured, we are in this with you to win it. So third, since 2013, the foundation has supported efforts to break down silos and promote collaboration between the healthcare sector and domestic violence organizations, as you heard in the video, especially through the work of the Leadership Council in partnership with the Domestic Violence Council and LA Department of Public Health. And you all are really the leaders in the state in doing this work and in thinking about how to bring the healthcare and domestic violence sectors closer together. You know, we're a health funder at Blue Shield of California Foundation, so we really see the importance of building these bridges, helping to address what are called the social drivers of health, leverage healthcare programs like Medi-Cal and others to make investments to more holistically prevent poor health outcomes and promote individual health. There's a growing evidence base that addressing these drivers of health can improve outcomes and do so more cost-effectively and equitably than just investing in medical outcomes alone. So in recent years, we've worked with the Mathematica consulting firm, Futures Without Violence. I think I saw you all showing up. The partnership and some of you in this room to imagine how Medi-Cal could do a better job in addressing and preventing domestic violence. Most recently, earlier this year, we published an issue brief on the importance of addressing intimate partner violence in the context of improving maternal health outcomes. We were really surprised to learn that pregnant women are more likely to be murdered during pregnancy or immediately postpartum than they are to die from hypertensive disorders, hemorrhage, or sepsis, the three leading obstetric causes of maternal mortality. So for us, this statistic really highlights the importance of intentionally addressing intimate partner violence in your maternal health strategies. So you can find this issue brief on our website. So you'll hear more about many of those issues during the day today. We look forward to learning from you, both today and in the work still to come, about the opportunities and challenges that you all are seeing in your communities to better meet the needs of survivors. So please enjoy the symposium. And back to you.
We want to thank our sponsors, the Blue Shield of California Foundation and the National Health Resource Center on Domestic Violence.